MD, Lung Disease and Respiratory Health, Coronavirus News. Coronavirus lingers in penis and could cause impotence, by Dennis Thompson. Health Day Reporter, Thursday, May 13th, 2021. Health Day News. Men now have one more compelling reason to get a COVID-19 vaccine. Doctors suspect the new coronavirus could make it hard to perform in the bedroom. How? Coronavirus infection is already known to damage blood vessels, and vessels that supply blood to the penis appear to be no exception. Researchers armed with an electron microscope found coronavirus particles in penile tissue samples taken from two former COVID-19 patients who became impotent following their infection, which had occurred 6 and 8 months earlier. Further study revealed evidence of blood vessel damage in the penises of the COVID-19 patients compared to two other men with erectile dysfunction who'd never been infected. Interesting. The researchers reported May 7th in the World Journal of Men's Health. We found that the virus affects the blood vessels that supply the penis, causing erectile dysfunction, said senior researcher Dr. Ranjith Ramasamy, director of the reproductive urology program at the University of Miami's Miller School of Medicine. The blood vessels themselves malfunction and are not able to provide enough blood to enter the penis for an erection. Ramasamy compared this to organ damage in the lungs, kidneys, and brain that's been found in COVID-19 patients. We think the penis also could be affected in a similar way, Ramasamy said. We don't think this is a temporary effect. We think this could be permanent. The new report focused on two recovered COVID-19 patients undergoing penile prosthesis surgery for their erectile dysfunction. Both men had normal erectile function prior to their infections. One of the men had been severely sick with COVID-19 and spent 2 weeks in the hospital before he recovered, but otherwise was free from chronic health problems. The other man had a relatively mild case of COVID-19, but suffered from clogged arteries and high blood pressure before becoming infected. Both men still had COVID-19 particles in their penile tissue, as well as evidence of endothelial dysfunction, a condition in which the linings of small blood vessels don't function properly and fail to provide adequate blood supply to different parts of the body. By comparison, two COVID-free men also undergoing surgery for erectile dysfunction had no evidence of the same sort of small blood vessel damage in their penises. I think this is probably not something men are discussing right now with all of the things that are going on, Ramasamy said. I'm fairly certain in the next 6 months to 1 year we will probably get a better sense of the true prevalence of erectile dysfunction among COVID-positive men. It makes sense that COVID-19 could affect men in this way, given the virus' ability to cause inflammation and damaged blood vessels, said Dr. Ash Tiwari, chair of urology at the Icahn School of Medicine at Mount Sinai in New York City. However, Tiwari cautioned that men shouldn't panic until more research has been done. One or two patients don't make a fact, but this is worth investigating from our standpoint, Tiwari said. COVID is an endothelial dysfunction. The small arteries of the heart can get impacted in the same way that the penile blood vessels can get impacted. Ramasamy urged former COVID-19 patients now suffering from erectile dysfunction to seek medical help. Don't think this is something that's going to go away on its own. We think this could be a long-lasting effect and not a temporary one, Ramasamy said. There's one other piece of advice he has for men worried about this. Don't get COVID. Get vaccinated so you don't get COVID, Ramasamy said. More information. The Cleveland Clinic has more about COVID-19 and erectile dysfunction. Sources: Ranjith Ramasamy, Director, Reproductive Urology Program, University of Miami Miller School of Medicine, Miami. Ash Tiwari, MD, Chair, Urology, Icahn School of Medicine at Mount Sinai, New York City. World Journal of Men's Health, May 7th, 2021, online. WebMD News from Health Day. Copyright 2013 to 2020 Health Day. All rights reserved. Sponsored ads. Treatment for neuropathy in feet. How to reverse diabetes naturally. High blood pressure diet. Type 2 diabetes medication. Lower back pain exercises. Causes of excessive sweating. Top picks. Treating COVID-19. One you should know. What to expect when you get the COVID-19 vaccine. How do we reach herd immunity for COVID-19? COVID-19 vaccines. One you need to know. Vaping and lung disease. What does vaping lead to lung disease? Does vaping lead to lung disease? Health solutions from our sponsors. Relief from sciatica. So basically, when you are infected with COVID-19, is endothelial dysfunction, which means the arteries, small arteries from heart or any parts of your body will be impacted. They don't function properly. Maybe it becomes plastic, a little bit plastic, not flexible enough, and it blocks the good flow of blood so that the blood doesn't get to cells. And blood supplies nutrients and oxygen and carries away the carbon dioxide or all other waste of the cells and blood. So if the arteries are infected, you are not going to have enough energy, enough oxygen, and the blood will not hold inside your penis, so that you will have erectile dysfunction. This Ranjith, the Director of Reproductive Urology at the University of Miami Miller School of Medicine, found 2 COVID-19 patients, all of them are men, are having erectile dysfunction because they were infected by their penises were working fine before they got COVID-19. So obviously, their erectile dysfunction can be traced back to the COVID-19 infection. Uh, they found nothing wrong with arteries of the normal erectile dysfunction patients. So those doctors, Tuwari and Ranjith, think that COVID-19 affects the arteries of our body, and the affected arteries in turn make the erectile dysfunction serious. Maybe we will have sexual desire, maybe we become horny, but our penises don't function properly. So it would be very painful for men not to have sex when they really want to do it. So the doctors recommend a full vaccination. Got COVID vaccine to ward off this erectile dysfunction. Of course, I should shun away from drinking in the public place. I should shun away from the restaurants, from the social gatherings, I'm not religious, but people should stay away from religious gatherings like sermons, Sunday school. So let's go over key expressions that I learned. One thing comes to my mind. It is under surgery, erectile dysfunction, COVID, confident. There's no word confident, but let's go back and see what I can remember from reading this material. Lingers in penis, penile tissues, penis, and could cause impotence. Dennis Thompson, Health Day reporter, Health Day News. Doctors suspect damaged blood vessels, blood arteries, vessels that supply blood to the penis. Further study, following their infection 6 and 8 months earlier. Further study revealed evidence of blood vessel damage in the penises of the COVID-19 patients. Terrible. Erectile dysfunction. Senior researcher Dr. Ranjit Ramasamy. Papi. Enough blood to enter the penis for an erection. Organ damage in the lungs, kidneys, and brain. In a similar way, we don't think this is a temporary effect. We think this could be permanent. We don't think this is a temporary effect. We think this could be permanent. Terrible. We don't think this is a temporary effect. We think this could be permanent. Penile prosthesis surgery. I don't know. Penile prosthesis surgery. The penis stays hard all the time, like a prosthesis becomes stiffy all the time. Erectile prosthesis surgery. Tay spent 2 weeks in the hospital before he recovered, but otherwise was free from chronic health problems. Clogged arteries, blood vessel damage, clogged arteries, and high blood pressure. Endothelial dysfunction properly failed to provide adequate blood supply to different parts of the body. By comparison, By comparison, two COVID-free men also undergoing surgery for erectile dysfunction had no evidence of the same sort of small blood vessel damage in the penises. By comparison, KT is much better than SKT or LGU minus. By comparison, I'm fairly certain true prevalence of erectile dysfunction. I'm very certain that in next 6 months to 1 year, we will probably get a better sense of the true prevalence of erectile dysfunction among COVID positive men. The true prevalence of erectile dysfunction. True prevalence of erectile dysfunction. The true prevalence of erectile dysfunction. I'm fairly certain in the next 6 months to 1 year, we will probably get a better sense of the true prevalence of erectile dysfunction among COVID-19 positive men. I'm fairly certain in the next 6 months to 1 year, we will probably get a better sense of the true prevalence of erectile dysfunction. It makes sense. At the Econ School of Medicine at Mount Sinai in New York City, Tuwari cautioned that men shouldn't panic until more research has been done. Tuwari cautioned that men should not panic until more research has been done. 1 or 2 patients don't make a fact. 1 or 2 patients don't make a fact, but this is worth investigating from our standpoint. 1 or 2 patients don't make a fact. 1 or 2 patients don't make a fact. The small arteries urged, I am fairly certain that we would get a better sense of the true prevalence of erectile dysfunction. Don't get COVID, get vaccinated so you don't get COVID, Ramasamy said. So that's it for today.